I work for the Tony Blair Foundation based in London, and the Tony Blair Foundation takes an interfaith approach towards malaria prevention in Sierra Leone. It is an international organization that works in many cities in the United States. Atlanta is one. Also, there are fellows in New York, San Francisco, also in Canada, India, and London, and also in Sierra Leone. The project came about after Tony Blair was out of office. He decided he wanted to work on malaria prevention in Sierra Leone. And Sierra Leone is a country that has 102 doctors for 5.7 million people. And that's a staggering number. That means that there is really only one doctor for almost 50,000 people in the country. And when you see that number, you realize that it's very rare that a person will see a doctor. However, in order to fight malaria in an effective way, Tony Blair decided to focus his efforts on faith communities. So while a person may not ever see a doctor, they will see their pastor or they will see an imam. And that person has sway with the community such that they can talk about health disparities like malaria prevention. My job as a Tony Blair Faith Act Fellow is to support the initiatives on the ground in Sierra Leone any way that I can, and also to promote the organization that I work with. MedShare is the organization that I work with presently. And MedShare is a health nonprofit. It sends surplus medical supplies abroad to different countries. And so my initiative this year is to bring in 5,000 new faces to MedShare, but also to promote this initiative on the ground to fight malaria in Sierra Leone by sending 2 containers of medical supplies, including bed nets in those containers, to Sierra Leone this year. And in doing so, my counterparts on the ground in Sierra Leone will be able to distribute those bed nets to families in need. Malaria is a very prevalent disease throughout Africa. It is said that every 45 seconds a child dies of malaria. And in fact, women and children are the face of malaria around the globe. And it affects poorer nations disproportionately. So MedShare, working in this field, has decided to support the Tony Blair Faith Foundation initiative in Sierra Leone by partnering and running this art auction. It's called the World Malaria Day Art Auction, and it takes place on April 25th, and that is, World Malaria Day. And basically the way it works is all the art that is sold, all the proceeds from that artwork will go towards a container of medical supplies to Sierra Leone. The art is quite unique. We have volunteer artists from all walks of life who have volunteered their time, sometimes 2 and 3 times a month, to come to MedShare and create their pieces. It's really quite innovative because as MedShare gets its medical supplies from 32 hospitals in the Atlanta area and from medical manufacturers, as volunteers sort those supplies and package them and get them ready for distribution, sometimes we accumulate expired medical supplies that we cannot send. Rather than throw those away and put them in a landfill, what MedShare has done and the Tony Blair Faith Foundation has done is we've given these supplies to local artists so that they can create unique pieces out of that art. And if you come to the art auction next week, then you'll be able to see those works of beauty, those works of art. Please come to the art auction. Again, it's 7 o'clock at the College of Management at Georgia Tech, and it's going to be an incredible event. Also, I'll say that it features artwork by artists such as Kevin Cole, an Atlanta artist here, and also artists from the Southwest Art Center, Wonder Root, the Re-Inspiration Store, Georgia State art students, and SCAD graduate students. So I think it'll have a lot of really interesting artwork for people to come and see.